Well, February is a beautiful month. Love is in the air, especially on Valentine's Day, and it's a perfect time to show a little love to yourself.
It's also Heart Awareness Month, a good time to get a heart health checkup because seconds count with every heartbeat.
Yes, that's right. I love that. Our heartbeat there. Dr. Aravind, I knew I was going to.
Aravind Reddy.
Aravind Reddy, Iroquois Memorial Hospital Cardiologist, and Mary K. Lavicka. Did I get that?
You got it right.
Oh, my word.
Yes.
Outreach Director at Iroquois Memorial Hospital. Hopefully cardiologists do a little bit better with pronunciation. So what is a cardiologist's job?
A cardiologist's job generally used to be treating patients when they get sick, especially when they come in with a heart attack. But we want to change that a little bit and also focus on prevention.
Oh, so being proactive with your heart health.
Take care of that before they get sick.
When we were talking to Dr. Cocherole earlier, he was saying diet, exercise, and then monitoring, right? And that's really important to making sure and getting that into people's heads that they need to get these checkups, right, Mary Kay?
Absolutely, absolutely. That's what we're trying to do for our event is raise awareness for everyone and taking those little steps every day to make a difference in their heart health, such as not smoking, getting some exercise, eating properly. As I'm looking at those snacks for Super Bowl Sunday, I saw some healthy snacks.
Well, it's all over there. So which of those things are healthy? Which are good for our heart?
Well, absolutely. The number one that I see is the fresh vegetables.
Okay.
I mean, we're to have a serving, several servings of fresh fruits and vegetables every day. So that's a great start. That's a really good start.
And the avocado, maybe?
Avocados are awesome. Yes, they can take place of, you know, the fatty things on your sandwiches and on your snacks.
So, Dr. Reddy, what kinds of things do you encourage people to do? Are there certain tests that you have performed on them to help monitor where they are when they're trying to get a sense of what their heart health is?
Check their cholesterol and make sure the cholesterol numbers are good because we have very good treatments for that. That's one of the major causes. There's been at least a 60% reduction in death from heart disease in the last 40 years in America, and the majority of that is from prevention. Half of that reduction is from prevention, and half of that has been from what we do as treating when they come in with a heart attack. They go to the hospital right away within half an hour, an hour. The sooner you get to the hospital, the better it is, so we can open the artery and prevent damage to the heart muscle.
And that's for both heart and stroke, right?
Absolutely.
The same thing.
Absolutely.
Exactly.
Now, when we're talking about stress tests, is that something that you need to do as a preventative measure to take, or is that something the doctor would prescribe for you to do because they have a concern?
That has changed. In the past, we used to do that as a preventative thing, but the recommendation now is not to do it as a screening because there's too many false positives. When you get an abnormal test, you end up doing multiple tests, which are expensive and a waste.
And
not necessary.
Yeah, and so Mary Kay, that's part of why what we're talking about here is so important. That's why your theme is You Are the Cure, right?
Exactly. That's what we're wanting to share with our participants that come to our Heart Health event. They're going to learn some of the things that Dr. Reddy does at Iroquois Memorial Hospital as a cardiologist, and then partnering with Dr. Cocherole, he's going to specialize in some of the things that he does with folks that have heart rhythms disorders. So he is an electrophysiologist, and so he's going to help with those folks that have those types of disorders.
And we're talking about the heart scan that you guys are being kind enough to give away as part of our CI Giving. I had one of those last year, and 2 years ago, and it was a great thing. So tell people at home why this is so important.
Okay, this is a great screen for those. A good candidate is someone, 40 or over, and it gives us an opportunity to look at the calcium calcifications in their arteries. So it's a good early detector for coronary artery disease. It's non-invasive, so it doesn't hurt. It's just a matter of
radiation.
Yep.
If you see calcium, that means you have a heart disease. But if you do not have calcium and you're older, it's a very good possibility that you do not have heart disease.
All right. Well, and it's important, again, to take charge of your health, right, and work with your doctor.
That's the main thing. That's the new goal from American Heart. They have 7 simple steps that they recommend taking. Exercising about 30 minutes a day for 5 days a week. know your numbers, control your cholesterol, losing weight,
Not smoking.
and not smoking.
There
Yes.
you go.
Very important and a
Great
very
tip.
easy thing to do. Once you can get off it, you can really improve your heart health.
Exactly.
All right, thanks so much for coming in. As a reminder, you still have a few minutes left to enter into that CI Giving sponsored by Iroquois Memorial Hospital. Sounds